So I think now the future will be dependent on some of these studies in terms of where we're going with margetuximab. It has been looked at in other tumor types as well, and breast cancer namely with a phase 3 study called the SOPHIA study, where it seems to have improved PFS, and we're waiting for the overall survival endpoint to see if that would lead to an approval there in the third line setting of breast cancer. And then for gastroesophageal cancer, really the first evidence we will see is the cohort A, the single arm study of the chemo-free regimen, which is appealing to patients to see if you're eligible for that study without having to get chemotherapy and having response rates similar or better to standard of care with much better tolerability, less side effect. That's very appealing, and we'll be hearing about that within the next year or two as that study accrues. The phase 3 study will be sort of over a longer period of time, several years before we see the evidence of that, before that becomes a reality for all patients with HER2 positive disease, even at lower levels and with PD-L1 scores that are negative.